Hi, good evening, everybody. I'm Dr. Maria Sophocles. This is an episode of Gynecollege, the Facebook live stream and YouTube show that we do from Women's Healthcare of Princeton to help educate, empower, enlighten, and maybe even enliven things for our patients and non-patients who want to tune in and listen and learn. Tonight's episode is going to talk about periods, heavy periods, how to lighten periods. There's so much misinformation out there about everything on the web, but including about solutions for periods. And you have to be super careful that you're not watching TikTok and trying to squeeze lemon juice or sit on ice cubes or do some of the crazy things that have been purported to lighten the periods. That said, there are plenty of ways to help with periods. I want to start tonight with just talking about what is a normal period, okay? Normal periods occur maybe every 25 to 35 days. There is a regularity to the cycle, and the bleeding lasts for 1 to 5 days. There is variability, of course, but if you have a period, so how do you know if your period is too heavy? How do you know that your period is heavy enough that you should be seeking help or asking for help or considering trying to lighten your period? Well, if you're soaking a pad closer than every 2 hours, that's too heavy. If you're soaking your bed sheets at night, that's too heavy. If you're passing blood clots, especially bigger than a dime, that's too heavy. Why? There shouldn't really be clots per se. The endometrial lining should get to shed, and this is lining tissue and blood, and it should never be so much and so quickly that it backs up and is able to form a clot. So when patients tell me they pass clots the size of a quarter or a lemon, I'm telling them this is too much bleeding. If you bleed more than 7 days, if your period is lasting more than 7 days, especially if 3 or 4 of those days are heavy, that's too heavy. If you're tired or dizzy every month when you have a period, and then you spend the rest of the cycle catching up, becoming no longer tired or dizzy, only to bleed and then be tired or dizzy again, that's too heavy a period. So if you're suffering from heavy periods, you do not need to. There are plenty of ways to lighten the amount of blood coming out and shorten the number of days. You do not need to suffer through that. You do not need to endure heavy periods, and do not mistake a heavy period for something that you feel is natural or normal. A heavy period is miserable, uncomfortable, and can be dangerous. I have patients who get blood transfusions every month because they bleed so heavily that they're so anemic they can't get out of bed, they can't drive, they can't go to work, but they don't do anything to lighten the periods, or even their doctor sometimes just gives them the blood transfusions every month. Not necessary. It's completely healthy to lighten a period, and you will not cause long-term harm, damage, reduce your fertility, decrease your ability to have a baby, anything like that. So let's talk about some solutions. Tonight's going to be a rather short gynecologist for a couple of reasons. One, I'm doing this by myself, no guests tonight, and that's intentional, but it's also because it's August, it's summer. I want to, keep you guys informed, but I want everyone to get out and enjoy some nice weather while we have it. So, solutions. How can you lighten your period? Do you have to use medications? The answer is most definitely and most commonly yes. There aren't any holistic or herbal remedies that will consistently lighten a period. There are medications whose side effects may lighten a period, but you wouldn't want to take something for blood pressure just to get your period lightened. There are specific medications available. They are prescription, but any gynecologist or pediatrician or primary care physician can order them for you. The most common medication used to lighten a period is the birth control pill. So birth control pills are not just for contraception. We call them birth control pills. That's terribly misleading. We also use birth control pills in gynecology to clear up skin, to help smooth out the moods of PMS, to reduce menstrual migraines, to control irregular periods, and also to lighten periods. And pills today are much lower dose than they used to be when I was a teenager, and they had more side effects. Now they're much better tolerated. The number one reason people are afraid to use a birth control pill is that they're afraid that it will cause weight gain. So weight gain in the pill is not a given. Plenty of people get on the pill and don't gain any weight. But the average weight gain on a birth control pill is about 2 kilograms, which is about 4 pounds, 4 to 5 pounds. Now, does that mean you are definitely going to gain weight on the pill? No, absolutely not. Plenty of people gain no weight or 1 or 2 pounds at most. Birth control pills are either made of estrogen and progesterone or just progesterone. In general, we prescribe the estrogen and progesterone pills. Those are the most widely used. Those are the best at controlling the cycle. In women for whom estrogen is not permitted because of coexisting medical conditions, we use progesterone-only pills. In either case, a pill's taken every day, and the last few days of the cycle, the pills are usually made of sugar or vitamins. This mimics what happens in our bodies, a drop in estrogen, which signals the uterine lining to shed. The estrogen is what supports and keeps the uterine lining in place, and when we remove it, the uterine lining sheds. And this is what a period is. So a period is really just the nice little fluffy bed of cells that we make in order to support an embryo. And when the embryo doesn't happen, when you don't fertilize an egg, the nice little fluffy bed of cells called the endometrium is shed, is thrown away. So you're just throwing away blood and tissue every month. So hormonal birth control pills work by preventing ovulation. They prevent the release of the egg from the ovary. They also, by having those placebo or vitamin pills at the end, cause a monthly shedding of the uterine lining, and that way it's not building up. But they work over the first 3 to 6 months that you take them. They continue to decrease the amount of uterine lining that is grown. And so after 3 to 6 months of many birth control pills now, you have almost no period at all. On average, they reduce the blood flow by about 80%. So think about that. Think about all the tampons, all the pads, all the blood, and how you are not going to bleed 80% of that. So periods become extremely light, and people on the pill are extremely happy that their periods are so light. When they're that light, there's just very little squeezing of the uterine muscle, so there's very little cramping. So the pill will make periods regular, it will make them light, it will shorten the number of days that you bleed, decrease the amount of bleeding, and decrease the pain with the period. So it packs a lot of punch. Let's talk about IUDs. An IUD stands for intrauterine device. An intrauterine device is a little piece of plastic shaped like a T that a practitioner inserts into the uterus. It can have no hormone in it, or it can have a type of progesterone called levonorgestrel. Levonorgestrel is, as I said, a type of progesterone, and a little bit will leak out of the IUD every day onto the lining of the uterus. This is a phenomenally efficient way to reduce the growth of the tissue lining the uterus. So just like the pill, an IUD will reduce period flow by 80%. Women often with IUDs have no period whatsoever, and they're extremely, extremely happy about this. So you may be asking yourself, well, if I'm not having a period, isn't that unsafe or unhealthy? Won't that affect my fertility? Does that mean I can't get pregnant? The answer is no, it's not unsafe. It's not unhealthy. It has zero impact on your ability to have a baby in the future. Once an IUD is removed, or once the pill is stopped, your body returns to building up that uterine lining. So it's perfectly safe to have no period from an IUD or a pill. It's just a temporary thing. It has no long-term effects on your health. Um, Having healthy, short, light periods, on the other hand, can have great effects on your health if you're not being made anemic by a heavy period, if you're not staying home from school or work or having terrible cramps from miserable periods. So there's much more to be gained from lightening a period and basically nothing to be lost. What other ways? Well, we know there are other contraceptives that will also make the period basically go to zero. The implant, the Nexplanon implant, which is a little matchstick that goes in your arm right here. It's sort of the shape of a matchstick. And it's like an IUD, except it's in the arm. So instead of a local effect, it's systemic, more like a pill. It too will result in almost no period. The Depo-Provera shot is progesterone that is injected every 3 months. That too usually leads to no period. Many of the birth control pills today, their formulations are such that they result in no period. So it's easy to have reliable, reversible, safe contraception that also will really markedly lighten your period. What about something that's non-hormonal? What about something that has nothing to do with contraception as well? Well, there is a medication that's FDA approved. It's a prescription medication called tranexamic acid. Tranexamic acid, or the brand name Lighten, it works actually on the ability of the blood to clot. So it works on the blood itself rather than in the ovaries or the brain or the uterus. And it will reduce blood flow by about 30%. So certainly not as powerful as a birth control pill or an IUD, but a wonderful, wonderful way to take pills only a few days a month and have your period be lighter. Tranexamic acid is used only during the period and only during the heaviest days of your period. So if you bleed, let's say 5 days, and the first 3 days are heavy and the second 2 days are light, you would only take tranexamic acid on those first 3 days. How do you take it? It's 2 pills 3 times a day. So again, TRANEXIMIC, tranexamic acid, ACID. And, it's not my first choice for people with heavy periods, only because it doesn't have any contraceptive benefit, and it doesn't lighten the flow as much as the pill or an IUD. But for people who don't want anything hormonal or don't want to have to take a pill every day, it's a wonderful, wonderful option. Okay, what about non-medication options? What can we do without medication? Well, this is a tricky question, and until about 20 years ago, the only other option was to do a hysterectomy, and plenty of women didn't want a hysterectomy, even if they were finished having children. So, again, around 20 years ago, a procedure was developed called endometrial ablation. Endometrial ablation. Endometrium is the lining of the uterus. Endometrial ablation is the selective destruction of the lining of the uterus. That's the bed from which the period grows on. So it's a 5-minute painless procedure. In my practice, it's done in my office. In some practices, you have to go to the hospital to do it. It warms and destroys the uterine lining. So it results in very light to no periods. And it is very effective. So women love it because it's not surgery. It's not hormones or any medication at all. It's something done in an office setting. You get up, you walk out, you have some cramps that day, but by the next day, you are completely back to normal. So it's a very fast recovery, and it spares people the risk and the hospitalization needed for hysterectomy. So you must know, though, that endometrial ablation, you cannot have a baby after that. So this is only for women who have completed childbearing. But this is a great option for women, say, in their 40s, mid-40s, they're having horrifically heavy periods, and around the perimenopause transition, the decade just before menopause, periods can get miserably heavy, irregular, heavy, both. And so for these women, endometrial ablation is a wonderful option. So those are in general the solutions. I want to take some questions. Madison has a question. I have a lot of questions about IUDs. Do you recommend someone in their 20s having one? If so, is there a particular IUD you recommend? Great question, Madison. I have lots of patients who wish their periods could be light, and they've heard about IUDs, but they've actually only heard bad things. And that's the classic situation where if I put an IUD in 100 women and 95 of them have no issues whatsoever, but 5 of them have some cramping or spotting or it just doesn't agree with them, those 5 women will post on the internet, will tell all their friends not to get an IUD. The 95 women, Madison, who are perfectly happy, just keep quiet about it, enjoy their IUD, and that's the end of it. So I would say I do recommend IUDs for women in their 20s, especially women who have busy jobs or are just having babies and their life is crazy with babies or are in college. It's wonderful because it is long acting and it's reversible. And I mean fully reversible right away. So if I put an IUD in you, Madison, and at 23 you say, I'm going to have a baby and I want to have a baby right away, you can come into the gynecologist's office. We grab the little string, we pull it out. It does not hurt to come out, and your fertility will be restored basically the next day. So that is pretty darn fast to reverse it. Now, I mentioned this before, but there are 2 basic categories of IUDs, no hormone and hormone. And I want to say really loud and clear, hormone is not a bad word. Hormone is not something to be avoided. Hormone is a wonderful thing, a blessing. We're all pickled in hormones, and it's the hormones that in our body make us who we are and make us function in a healthy way. So the IUD that has hormone in it has just progesterone, no estrogen, and it has a tiny, tiny, tiny amount. So the dose is incredibly low. That IUD, that little piece of plastic, think of it as just leaking a little drop of progesterone out right in the uterus, right onto the cells that need it. So the little bit of progesterone comes out of the IUD, goes right into the uterine cells and makes them not grow. So your periods get crazy light and you don't get pregnant. There's no nice little fluffy bed of cells for an embryo in which to implant. Okay. The particular IUD I recommend is called Lighten, Liletta, Liletta. The other brand is Mirena or Kylena. These are both made by Bayer Pharmaceuticals, and these are great and fine. There's nothing wrong with them. The reason I like Lighten is that it is part of a nonprofit company which donates an IUD to an underserved woman, a woman in an underserved country, a woman who perhaps could never afford to get an IUD, and often a woman who desperately needs to control the size of her family. So whenever I purchase an IUD for a patient, and they will then send one to a woman in an underserved population. And I think that this is one of the best things we can do is to raise women up in impoverished communities. And many books and newspaper articles and research has been done on this, that if you lift women out of poverty and if you give them control of their reproductive health, you benefit the whole community, you benefit their whole country. So any company that is willing to do that gets my vote. But doesn't mean you have to use Lighten. You could use Lighten, Mirena, or Kylena. All 3 are IUDs with progesterone. Okay. The reason I don't recommend the copper IUD, the non-progesterone one, is simply that even though it works, it's perfectly effective, it tends to make periods a little heavier and a little longer and a little more miserable. I'm just not sure why anybody would want that if they had a choice. Madison, if you have any other questions, I'd love you to post them. So give me some specifics so that I can answer your specific questions. But while I'm waiting for you to maybe ask another IUD question, I'll just say that we we used to just put IUDs in older women. We thought, I guess you can only put them in if women have already had kids. And that's not true. We put them in teenagers, we put them in women in their 20s, we put them in women of all ages. We actually use them also to lighten heavy periods, even without contraception. We even use IUDs when women have precancerous cells in the uterus to reverse them back to normal cells. So they are absolutely godsends in gynecology. So please, Madison, send me your other questions. And in the meantime, we had another question, which was about hysterectomy, because certainly the most definitive way to lighten and permanently stop a period is a hysterectomy, a removal of the uterus. This is a surgical procedures. So Kara Krieger asks, are any MDs doing preventative hysterectomy? And the answer is, well, it depends what you mean by preventative, but I think what you mean is doing a hysterectomy in a woman so that they don't have to have periods anymore. The answer is yes. There are certain women for whom hysterectomy is important. Women who have been shown to have a genetic high risk for uterine cancer, for example. There's something called Lynch syndrome. Lynch syndrome is something we can diagnose but just by spitting in a little cup and sending it for genetic analysis. And in Lynch syndrome, people have a much, much higher risk of cancer of the uterus or the bowels. We do hysterectomies on these women preventatively. Same for women who have a lot of uterine cancer in their family or other cancer syndromes. Sometimes if women are going to be put on a medication that has as a side effect potentially increasing abnormal cells in the uterus, they'll opt for a hysterectomy. Other women just have hysterectomies because they're bleeding too heavily, or they're uncomfortable from fibroids, or they don't want to have an organ in their body anymore that can cause cancer that they don't need. Either they haven't had children and they never want to have children, or they've had their children and they say, I want to live a long life, and I was a smoker and I know that smoking increases the risk of uterine cancer. By the way, the risk factors for uterine cancer: smoking, diabetes, being overweight, and high blood pressure. So if you have one or more of those, some women will say, I don't want to wait to figure out I had cancer. So bottom line, Kara, is yes, there are MDs doing preventive hysterectomy, but we do need to justify it in some way. So an insurance company will not pay for a hysterectomy unless we can say either this patient's having heavy bleeding, they have fibroids, they have elevated risk for some reason or other, or they have anxiety. Sometimes we just say the patient has anxiety and wants to have a hysterectomy. I hope that answered your question. Great, great question. Thank you so much for answering it. Whew, I need a break. I feel like you guys have asked such good questions, and I feel like I've just been talking, and I'd love to hear some more of your questions. So if anybody else has a question, please, please ask away. I'm so thrilled that you would squeeze out 30 minutes of a beautiful, beautiful summer evening to listen and learn. I know periods can be literally the bane of our existence. Nothing makes me more frustrated than to hear a patient of mine say, I asked my last doctor about my heavy periods and was just told it's just part of being a woman. Yeah, but it doesn't mean you have to, it doesn't mean you have to suffer, So, Madison's asking another, or just giving us a little more info, that she would need the insertion of an IUD done under ultrasound because her cervix is so small. How does that go? Okay, let's just talk real quickly about that. How do we insert an IUD? Because a lot of people are really afraid of it, and they're really afraid of the pain. And I'm super proud of our practice at Women's Healthcare of Princeton. We jump through hoops to make it less uncomfortable. So an IUD is inserted through the cervix, okay? So a speculum is put, those duct-built things are put in the vagina. At the back of the vagina, we see the cervix. The cervix is the entryway into the uterus. So we do have to sort of dilate the cervix up. If that's the cervix, it's closed, right? If you haven't had a child, it's closed. We have to kind of wiggle and open it up a little bit to make a little opening to get the IUD in. In women who have had children vaginally, it's already open. It's usually really easy and not uncomfortable. But in someone who hasn't had children or who's had C-sections, it can be uncomfortable. So what can we do? Well, we give you a prescription of 2 pills that you put into the vagina the night before. They will soften the cervix up, make it easier the next day. Second thing you can do, you can take 3 or 4 ibuprofen about an hour before you come. Third thing, we can numb the cervix. How? Just like a dentist numbs your gums and teeth with a shot. So that sounds really scary, but to be honest, the needle's super, super tiny. And I think it's one of those times when a tiny little pinch can make a whole lot of discomfort go away. So that's how we do it. Now, if you have kind of strange anatomy or were afraid you had procedures on your cervix and it's kind of scarred shut, or in Madison's case, the cervix is very, very tiny, we might want to get help by having our ultrasound technician, Sherry Jones, guide us. So she'll be standing right next to the provider putting it in with an ultrasound. She'll put a little jelly on the patient's lower abdomen and a transducer that helps us look. It doesn't hurt at all. It's just jelly on your belly, and then we see the uterus. So that way, as we're inserting it, we're looking also at the ultrasound screen, and we can see that we're putting it in exactly the right place. It's really a great, great help. So at Women's Healthcare of Princeton, we definitely have lots of ways to make it comfortable. Finally, the way we can make it super comfortable is we have our own anesthesiologist who can literally give you a little bit of medicine. You take a little tiny light snooze, you wake up and the IUD is in. We've done this with tremendous success and patients love it. They just feel like they had a 1-minute awesome deep sleep. So the process can be very, very user-friendly, and I would really encourage it because I would say our IUD using patients are probably the happiest patients we have. There's just not a lot to talk about. So going to wrap this up pretty soon. Kara, let me see. To know there's several options. Every practice pushes Marina and minimizes concerns I have about it. Well, Kara, I would love to hear any other concerns you have about it. Kara's question is that practitioners minimize concerns that patients have about an IUD. No practitioner should ever minimize concerns, because if it's a concern to you, then it's a real concern. If you have a concern about the safety of tissues, might seem illogical to me as a practitioner or to someone else, but if it bothers you, shame on us to not take that seriously. So Kara, if you have other questions or other concerns, please voice them either here tonight or get in touch with me at info@princetongyn.com. Our web address is www.princetongyn.com, and call us, use the web, reach us. There are 5 women in the practice. We all care so much, and we'd love to make sure you're educated, informed, and that all your concerns have been addressed. So that's it for tonight. Because it's summer, we're going to take a little break. The next episode is September 16th, when we're going to talk about recurrent urinary tract infections, and they are miserable. So please, if you know anyone who gets recurrent urinary tract infections, make sure they're watching. It's going to be great. We have so many ways that we can help break that terrible cycle. I'm really grateful to everyone who tuned in tonight, and also to Sam and Michaela, who helped produce this. Thanks, guys. You do a great job. This is Dr. Maria Sophocles saying everybody have a wonderful, wonderful evening, and I'll look forward to talking to you all in September. Take care. Bye-bye.